Onto a story we teased for you before we took a break. Kenya is stepping up efforts to tackle the growing cancer burden amid concerns of increased cancer cases in the country.
Nairobi has recorded the highest number of breast cancer cases at 2,150 among counties, as Kisumu positions itself as a regional hub for cancer care, with plans to establish a specialized cancer center.
Now, the push is bringing together county governments, international partners, health experts, and cancer survivors in a report compiled by Marie Yambo.
Kenya records more than 42,000 new cancer cases and over 27,000 deaths annually, highlighting the growing pressure on the health system. Breast cancer is a major concern among women, with 2,150 cases reported between 2020 and 2020. Prostate cancer remains the leading cancer among men.
We want screening to become routine. We want diagnosis to happen earlier. We want treatment to be accessible. And we want patients who enter our health systems to feel that there is a clear pathway of care, rather than having to navigate that journey alone.
In Kisumu, the Africa Smart Cities and Towns Alliance, Kisumu County Government, and the African Cancer Foundation are working to establish the Chonjong Nyong'o Cancer Center. The partners plan to invest about $1 million, approximately 130 million shillings, in laboratory at Victoria Hospital to support early screening, targeting up to 300,000 people across the Lake Victoria region.
We are investing about $1 million to open the lab by the end of this year at the Victoria Hospital to start with the early cancer screening programs. And number two, we are also planning to training local doctors, nurses, engineers. And number three, we are going to bring the donations from Korea, Singapore, for example, in the United States. Very expensive, the CT scan, for example, like kind of these devices.
Kisumu County Governor Anyang' Nyong'o says stronger cancer services in the region will reduce the need for patients to travel long distances for specialized care.
We have, for example, Jaramogi teaching a referral hospital, which has been for a long time the only place you could go to in Kisumu if you had cancer. But even there, they didn't have all the equipment. So people ended up going abroad at a very costly price. So that going abroad for cancer treatment care is what we are trying to deal with.
For survivors like Kevin Mochiro, who has lived with multiple myeloma, a type of blood cancer, for 11 years, financial, emotional, and social impact of cancer is a stark reality.
Because this disease takes you through so many emotions. People forget that we are human, we still laugh, we still have joy, we still want to do we still have aspirations. So I think the attitude needs to change in how we treat patients. We need to see how we can bring down the cost of medication. And it's not just looking at early detection, but it's also looking at the care that we're giving patients.
As Nairobi and Kisumu counties strengthen, stakeholders say collaboration is essential to ensuring access to screening, treatment, and long-term support, regardless of where patients live or what they can afford. Maria Mo reporting for the Prime Edition.